When we speak about aging, we must first understand that the body does not simply grow older. It becomes wiser in some ways, yet more delicate in others. The systems that once tolerated stress with ease begin to respond differently. The heart is not as quick to adapt, the brain is more sensitive to chemical changes, and the body as a whole takes longer to return to balance after disruption. This is why we must challenge the long-standing assumption that stronger intervention automatically means better care. In many cases, especially for seniors, the opposite is true. Total anesthesia, while a remarkable medical advancement, was never designed with the fragile physiology of older adults as its primary focus. It is powerful, it is effective, and it is sometimes necessary, but it is not always the most appropriate choice. When we place a senior under total anesthesia, we are not just putting them to sleep for a procedure. We are temporarily altering how their brain communicates, how their lungs function, and how their cardiovascular system maintains stability. For a younger person, the body often rebounds quickly. For an older individual, that rebound may be slower, incomplete, or accompanied by complications that affect quality of life long after the procedure is over. We have seen this in the form of postoperative confusion, memory disturbances, prolonged fatigue, and in some cases, a noticeable decline in independence. Families often say they were not quite the same after surgery, and while many factors can contribute to that outcome, we cannot ignore the role that heavy anesthesia may play. It is not about creating fear. It is about encouraging thoughtful decision-making. The goal of medicine should never be to simply complete a procedure. It should be to preserve the person. As the body ages, its margin for error becomes smaller. What was once a routine intervention can carry amplified consequences. This is why a gentle approach is not a sign of doing less. It is a sign of understanding more. It reflects a deeper awareness that healthcare must evolve alongside the patient. We cannot continue to apply the same intensity of treatment across all age groups and expect equally positive outcomes. Seniors require a different kind of respect in medicine, one that recognizes vulnerability not as weakness, but as a factor that demands precision and care. There is also an emotional dimension that we often overlook. For many older adults, the idea of undergoing a procedure with total anesthesia can be unsettling. The loss of control, even temporarily, can create anxiety. When we offer gentler alternatives, we are not only protecting the body, but also supporting the mind. A patient who feels safe, informed, and involved in their care is more likely to experience a smoother recovery. Healing is not purely physical, it is deeply psychological as well. We must also consider the broader impact on independence. One of the greatest fears among seniors is losing the ability to care for themselves. A heavy intervention that leads to extended recovery or complications can sometimes trigger a chain reaction, reduced mobility, increased reliance on caregivers, and a gradual withdrawal from daily activities. This is not an inevitable outcome, but it is a risk we must take seriously. By choosing gentler approaches whenever possible, we actively work to protect not just life, but the quality of that life. Modern medicine has given us the tools to be more precise than ever before. We are no longer limited to all or nothing solutions. We can tailor our approach, reduce the burden on the body, and still achieve excellent clinical results. This shift requires a change in mindset from dominance to balance, from intensity to intention. It asks us to pause and consider not just what we can do, but what we should do. In this context, gentleness becomes a form of strength. It is the discipline to avoid unnecessary risk, the wisdom to adapt, and the commitment to place the patient's long, long-term well-being at the center of every decision. For seniors, this approach is not optional, it is essential. It acknowledges that aging is not a problem to be fixed, but a stage of life to be supported with dignity and care. So when we stand at the point of decision, we must ask ourselves a simple but powerful question. Are we choosing the path that merely completes the procedure, or the one that truly serves the person? Because in the end, the measure of good medicine is not how much we do, but how wisely we do it. If we accept that gentler care is necessary, then the next question becomes clear. Do we actually have the means to provide it? And the answer, reassuringly, is yes. Medicine has not stood still. It has evolved quietly, steadily, and with remarkable precision. What was once considered impossible is now routine, and what once required full sedation can now often be achieved with far less disruption to the body. The challenge today is not the absence of safer options, but our willingness to fully embrace them. There was a time when total anesthesia was seen as the safest way to ensure comfort and control during procedures. It simplified the process for the medical team and guaranteed that the patient would feel nothing. But simplicity does not always equal suitability, especially when we are caring for older adults whose bodies respond differently to stress. Today, we understand that keeping a patient completely unconscious is not always necessary to achieve the same clinical outcome. In fact, in many cases, it may introduce avoidable risks. We now have a spectrum of alternatives that allow us to tailor care with far greater accuracy. Local anesthesia, for instance, targets only the specific area being treated, leaving the rest of the body undisturbed. This means the brain remains active, the breathing remains natural, and the recovery begins almost immediately after the procedure ends. For many seniors, this approach reduces the likelihood of confusion and allows them to return to normal awareness without the heavy fog that often follows deeper sedation. Then there is conscious sedation, a carefully controlled state where the patient is relaxed and comfortable, yet not fully unconscious. This method offers a balance between relief and awareness. It allows the procedure to be performed smoothly while maintaining the body's natural protective functions. Patients often describe it as feeling calm and detached rather than completely gone. And importantly, they tend to recover much more quickly. For an older individual, that difference can be significant, not just physically but emotionally as well. We also have nerve blocks, which represent another step forward in precision. By temporarily interrupting the signals of specific nerves, we can effectively eliminate pain in targeted regions without affecting the entire system. This is not just innovation for the sake of advancement. It is innovation with purpose. It reflects a deeper understanding of how to work with the body rather than overriding it. Beyond these techniques, we are seeing a rise in minimally invasive procedures that reduce the need for heavy anesthesia altogether. Smaller incisions, advanced imaging, and refined surgical tools allow interventions to be carried out with less trauma and greater accuracy. The body is not forced into a state of deep suppression. Instead, it is supported through a controlled and respectful process. For seniors, this often translates into shorter hospital stays, fewer complications, and a smoother return to daily life. But with all these advancements comes a responsibility. Technology alone does not change outcomes, decisions do. It is not enough for these options to exist. They must be actively considered, discussed, and offered. Too often, traditional practices continue simply because they are familiar, not because they are the best choice. This is where both healthcare providers and patients must engage more thoughtfully. Seniors and their families should feel empowered to ask questions, to explore alternatives, and to understand that there are often multiple paths to the same goal. It is also important to recognize that safer alternatives do not mean compromised results. There can be a misconception that lighter methods are somehow less effective, but this is not supported by modern evidence. In many cases, these approaches achieve equal or even better outcomes, precisely because they reduce the stress placed on the body. When the body is not overwhelmed, it is better able to heal, to adapt, and to recover fully. This shift towards softer solutions is not about rejecting progress. It is about redefining it. True progress in medicine is not measured solely by how advanced our tools are, but by how wisely we use them. It is about moving from a mindset of control to one of collaboration with the human body. For seniors, this philosophy is especially important. It ensures that care is not only effective, but also aligned with their unique needs and vulnerabilities. We must begin to see these alternatives not as secondary options, but as primary considerations. They represent a more thoughtful, more refined approach to care, one that values precision over intensity and understanding over habit. When we choose these methods, we are not doing less, we are doing better. And ultimately, that is the direction medicine must continue to move in, towards solutions that heal without overwhelming, that treat without diminishing, and that respect the delicate balance of aging body while still delivering excellent results. When we talk about treatment decisions for seniors, we cannot separate the procedure from what comes after it. The true measure of success is not only whether the operation was completed, but how well the individual returns to life afterward. Recovery is not a small chapter in the story of care. It is the chapter that defines everything, and for older adults, recovery carries a weight that is often underestimated. Total anesthesia, by its nature, places the body into a deep and controlled state of unconsciousness. While this may be necessary in certain situations, it also means that the body must work harder to regain its normal rhythm once the procedure is over. For a younger individual, this transition may be quick and relatively smooth. But for a senior, the journey back can be slower, more demanding, and sometimes complicated in ways that extend beyond the physical. It often begins with something subtle, lingering drowsiness, a sense of disorientation, or a delay in regaining full clarity. These may seem temporary, but in older adults they can persist longer than expected. This delay can affect mobility, confidence, and even the willingness to engage in basic daily activities. A person who was independent before a procedure may suddenly find themselves hesitant, needing assistance, or feeling unsure of their own balance and strength. These changes, even if temporary, can have a profound emotional impact. Mobility, in particular, is a critical factor. The longer a senior remains inactive after a procedure, the greater the risk of muscle weakness, stiffness, and reduced coordination. What might have been a short period of rest can gradually turn into a cycle of reduced movement and increased dependency. And once that cycle begins, it can be difficult to reverse. The body, especially in later years, responds quickly to inactivity, but not always as quickly to rehabilitation. This is where softer approaches to care make a meaningful difference. When we avoid or minimize the use of total anesthesia, we often see a faster return to alertness. The patient is able to sit up sooner, to communicate clearly, and to begin gentle movement without the heavy burden of prolonged sedation. This early return to function is not just a convenience. It is a protective factor. It helps preserve strength, maintain confidence, and reduce the risk of complications that can arise from extended immobility. There is also the matter of independence, which for many seniors is deeply tied to their sense of identity. The ability to perform daily tasks, to move freely, and to make decisions without reliance on others is not just practical, it is personal. When recovery is delayed or complicated, this independence can be temporarily or even permanently affected. And while medical care may address the immediate issue, the loss of independence can linger as a quiet but significant consequence. Faster recovery, therefore, is not about rushing the process. It is about preserving what matters most. It is about ensuring that the individual does not lose more than they gain from the intervention. When we choose approaches that allow the body to remain more stable, more aware, and more engaged, we are actively supporting a smoother transition back to normal life. We must also consider the broader environment in which recovery takes place. Many seniors rely on family members or caregivers during this period. A prolonged or difficult recovery does not only affect the patient. It places additional strain on those who support them. By reducing recovery time and minimizing complications, we are not only improving individual outcomes, but also easing the burden on families and healthcare systems alike. Another important aspect is the psychological effect of recovery. When a senior is able to regain their strength quickly, to walk, to speak clearly, and to resume familiar routines, it reinforces a sense of resilience. It sends a powerful message that they are still capable, still in control, and still able to navigate their world. This confidence can significantly influence overall well-being and long-term health. On the other hand, a prolonged recovery can sometimes lead to frustration, anxiety, or even withdrawal. Feeling of being slowed down or not quite oneself can weigh heavily, especially if it persists. This is why the choices we make before a procedure are so important. They shape not only the immediate outcome, but the entire recovery experience. Modern medicine gives us the opportunity to think beyond the operating room. It allows us to consider the full journey of the patient, from preparation to recovery and beyond. And when we take this broader view, the value of gentler, more precise approaches becomes clear. They are not simply alternatives, they are often the better path. Because, in the end, the goal is not just to treat a condition, but to return a person to their life with as little disruption as possible. It is to ensure that when the procedure is over, the individual can stand, move, think, and live with the same sense of dignity and independence they had before. And that is why recovery should never be an afterthought. It should be the reason we choose wisely from the very beginning. As we bring all of these ideas together, we arrive at a principle that quietly sits at the center of good medicine, yet is too often overlooked in practice: the understanding that no two patients are the same, and that this truth becomes even more important with age. It is easy to follow a routine, to rely on standard procedures, and to apply familiar methods across the board. But when we do that, especially with seniors, we risk treating the condition while overlooking the person who carries it. Aging is not a uniform process. One individual at 70 may be active, independent, and physiologically strong, while another may be managing multiple conditions, taking several medications, and experiencing reduced resilience. Even when two patients share the same diagnosis, their bodies may respond in entirely different ways. This is why a one-size-fits-all approach, particularly in decisions involving anesthesia, is not only outdated, it can be harmful. Personalized care asks us to pause and consider the full picture. It is not just about what needs to be done, but about who it is being done for. It requires us to look beyond the procedure itself and examine the patient's overall health, their medical history, their level of independence, and even their emotional readiness. These are not secondary details. They are essential pieces of information that should guide every decision. When we approach anesthesia with this mindset, the conversation changes. Instead of automatically defaulting to total anesthesia, we begin to ask more thoughtful questions. What is the least invasive method that can still achieve the desired outcome? How will this choice affect the patient's recovery? What risks are we willing to take, and which ones can we avoid? These questions do not slow down care, they refine it. It is also important to recognize that personalized care is a shared process. It involves not only the medical team, but also the patient and, often, their family. Seniors should not feel like passive participants in their own treatment. They should be informed, heard, and respected. When patients understand their options, they are better equipped to make decisions that align with their values and priorities. For some, the priority may be minimizing risk. For others, it may be maintaining independence or avoiding prolonged recovery. There is no single correct answer, only the answer that best fits the individual. Communication, therefore, becomes a cornerstone of this approach. It is not enough to present a plan. We must create space for dialogue. We must explain not only what we recommend, but why we recommend it and what alternatives exist. This transparency builds trust, and trust, in turn, leads to better outcomes. A patient who feels respected and involved is more likely to approach their procedure with confidence and to engage actively in their recovery. There is also a deeper ethical dimension to personalized care. It reflects a commitment to dignity. Seniors in particular have lived full lives, gathered experiences, and developed perspectives that deserve recognition. To treat them with a standardized approach without considering their individuality is to overlook that richness. Personalized care, on the other hand, honors it. It acknowledges that each patient is not just a case, but a person with a story, a history, and a future that matters. In the context of anesthesia, this means being willing to step away from routine when necessary. It means considering softer solutions not as exceptions, but as valid and often preferable options. It means being attentive to the subtle differences that can influence outcomes, differences in metabolism, in cardiovascular stability, in cognitive sensitivity. These factors may not always be visible at first glance, but they are there and they deserve our attention. We must also be prepared to adapt. Personalized care is not a fixed formula, it is a dynamic process. What works for one patient today may not work for another tomorrow. Even within the same individual, needs can change over time. This requires flexibility, awareness, and a willingness to continuously evaluate and adjust our approach. It is a more demanding way of practicing medicine, but it is also a more meaningful one. As healthcare continues to advance, we often focus on new technologies, new techniques, and new discoveries. These are important, but they are only part of the equation. The true progress lies in how we apply these advancements, whether we use them to impose uniform solutions or to create tailored, thoughtful care that respects the uniqueness of each patient. For seniors, this approach is especially vital. It ensures that care is not only effective, but also appropriate, respectful, and aligned with their lived reality. It protects them from unnecessary risk, supports their independence, and acknowledges their individuality in a way that standard methods simply cannot. And in the end, that is what medicine should strive to be, not just a system of treatment, but a practice of understanding where every decision is shaped not by habit, but by the person at the center of it all.